Understanding alopecia areata. Causes, signs, symptoms, and treatment. Alopecia areata is an autoimmune disorder characterized by sudden hair loss, resulting in round, smooth patches of baldness on the scalp or other areas of the body. This condition can affect people of all ages and may cause emotional distress due to its impact on appearance. Here's a comprehensive overview of the causes, signs, symptoms, and treatment options for alopecia areata. Causes of alopecia areata. 1. Autoimmune response. Immune system attack. The body's immune system mistakenly targets hair follicles, treating them as foreign invaders. Inflammation. This immune response leads to inflammation around the hair follicles, inhibiting hair growth. 2. Genetic factors. Family history. Individuals with a family history of alopecia areata or other autoimmune conditions are more likely to develop the disorder. Genetic susceptibility. Certain genes associated with immune system regulation increase the risk. 3. Environmental triggers. Stress. Physical or emotional stress may trigger the onset or worsening of alopecia areata. Infections. Some infections could potentially trigger or exacerbate the condition. 4. Other autoimmune conditions. Associated disorders. Individuals with other autoimmune diseases, such as thyroid disorders or vitiligo, may have a higher risk of developing alopecia areata. 5. Chemical or physical triggers. Exposure to chemicals. Certain chemicals or allergens might play a role in triggering alopecia areata in susceptible individuals. Signs and symptoms. 1. Patchy hair loss. Sudden onset. Hair loss typically occurs rapidly, within a few days or weeks. Smooth bald patches. Round or oval patches of baldness on the scalp or other body parts, usually smooth and devoid of redness or scarring. 2. Exclamation point hairs. Characteristic hairs. Short, broken hairs at the edges of bald patches that resemble exclamation points. 3. Nail changes. Nail pitting. Tiny dents or pitting in the nails may occur. Ridges or roughness. Nails might become rough, ridged, or brittle. 4. Other patterns of hair loss. Totalis. Complete loss of all hair on the scalp. Alopecia areata totalis. Universalis. Complete loss of all body hair. Alopecia areata universalis. 5. Itching or burning. Sensations. Some individuals may experience itching or a burning sensation in areas of hair loss. 6. Hair regrowth and relapses. Cyclical pattern. Hair may regrow spontaneously but can fall out again, leading to cycles of hair loss and regrowth. Treatment. 1. Topical treatments. Corticosteroids. Creams or ointments that reduce inflammation and suppress the immune response, applied directly to the bald patches. Minoxidil. Over-the-counter medication to stimulate hair regrowth in affected areas. Topical immunotherapy. Chemicals like difensiprone, DPCP, applied to the scalp to provoke an allergic reaction that stimulates hair growth. 2. Injections. Steroid injections. Corticosteroids injected into the affected areas to reduce inflammation and promote hair regrowth. 3. Oral medications. Corticosteroids. Oral steroids used to suppress the immune system for more extensive or severe cases. Immunosuppressants. Drugs like methotrexate or cyclosporin used to dampen the immune response. 4. Light therapy, phototherapy. UV light treatment used to stimulate hair growth by altering the immune response in the skin. Alternative and experimental therapies. JAK inhibitors. Janus kinase inhibitors like tofacitinib and ruxolitinib, which have shown promise in treating alopecia areata by modulating the immune system. Platelet-rich plasma, PRP, therapy, involves injecting a concentration of a patient's own platelets to stimulate hair growth. 5. Supportive care. Wigs and hairpieces, options for cosmetic coverage to help individuals manage the appearance of hair loss. Counseling and support groups. Psychological support to help cope with the emotional impact of alopecia areata. 7. Lifestyle and home remedies. Gentle hair care, avoiding harsh treatments or hairstyles that pull on the hair. Stress management. Techniques such as relaxation exercises or therapy to manage stress, which can trigger or exacerbate hair loss. Alopecia areata is an autoimmune disorder leading to patchy hair loss that can affect the scalp or other body areas. Understanding the causes, including genetic and autoimmune factors, helps in managing the condition. Recognizing signs like smooth bald patches and exclamation point hairs along with available treatments such as topical therapies, injections, and experimental options, can aid in effective management. Supportive care, including wigs and psychological support, is also vital for those dealing with the emotional aspects of hair loss. Comprehensive treatment and care can improve quality of life and help individuals cope with alopecia areata.